the church, a bishop, and ask about the faith-based beliefs and practices. How have they contributed to these practices being invisible, and what would be the role of the religion or religious beliefs and practices to make it more visible and recognized?
Thank you so very much. I must first of all, with your permission, thank you so very much for this forum. And I'm over-excited to see our young people who spoke and gave their responses, the children in particular. And as you know, Africa is a very religious continent, and so is Kenya. And these religious convictions happens to affect us as a community, such that even those things that are harmful, they are intertwined with faith and beliefs. And when they are intertwined with faith and belief, our background as Africans is that we don't question. We just keep quiet. And we keep quiet about FGM, that is female genital mutilation, child marriage, because we found it there, and because it's somehow spiritually connected, we don't verbalize, we don't talk, we just receive it. And whether it is causing bodily harm, whether it is degrading, and then because of our background as hyped spiritually, we are prayed for, and when we are prayed for, that is all. And prayer only. And our parents are not able to go further into seeking medical care and knowledge. They just receive what they receive from the our elders, and so we just stay put. Then there is the issue of stigmatization, which makes, for example, the intersex, and I'm very happy that now we are talking openly, to go underground. We feel like we don't speak about it, and that actually does not solve the problem. It compounds the problem, and it will continue in the community. I believe what we are doing is the right trajectory, or the right thing, that we speak in the open. And indeed, when we are talking about a child, we have a philosophy, the Ubuntu philosophy. We are because you are. And that is what we believe as Africans. And joining it with religion, our good Christian teaching says, do unto others what, that is the golden rule, what you would want them to do to you. So I believe that we, in our religious setup, we don't have any religion that encourages harm to children. Now, we are privileged as religious leaders. And we have audiences who we call captive audiences. Every week they come to our congregation. And we should take advantage when people come to listen to us on Friday, Muslims, or Sunday, or the SDAs on Saturday. We ought to speak out against the harmful practices. And in community forums, religious leaders, we are privileged because we are given that wonderful opportunity wherever it arises. In the Bible, Matthew chapter number 18 and other scriptures, it speaks about the beauty of creation. Children are God's creation. We bear the image of God. we bear the character of God. Not only do we have the image of God, but we also have the value of God. So the children are important in the society. In fact, we owe them. And the future is theirs. So we should protect them. And in the Interreligious Council of Kenya, we crafted a child protection policy, which is a document that we have given to all the members. And in the Interreligious Council, we have the NCCK, we have the SUPKEM, we have the Shia ITHNA, we have the Hindu Society, we have Evangelical Alliance of Kenya, we have the African instituted churches. And so they are signatories to this child protection policy. And so we should protect the children and we should uphold their rights. Of course, as Africans, having received these practices and we have embraced them, we have a lot of work to help come out of it, to unlearn about these practices. And so it is our responsibility to come up with alternatives. For example, can we have non-harmful rites of passage? And we are doing it, and I thank God a step after another. Then again, I believe when faith meets science, a miracle happens. So what we should do is corroborate, partner with the medical world, health, social, and other partners like child protection services, so that we can change the narrative and we can have this happening. So we are doing it. It's not easy, but by faith, and this being one of those forums, we are going to get out of this. Thank you.
All right, let's appreciate Bishop Warari. And you're very right when you talk about like the captive audience that religious leaders have got access to. Of course, we all know that historically religion is described to be the opium of the masses. And there is this aspect of what you've talked about, faith, that with faith then they believe a whole lot of the religious teachings. And now I'd want you to reflect on those religious engagement with the religious leaders, and maybe what are the 1, 2, or 3 things would you want to recommend to religious leaders to do such that they champion the aspect of like what Kibagendi talked about, creating awareness, but also what you've just talked about, Bishop, that coming up with other alternatives, meaning that then we are abolishing these harmful practices. What do you tell the religious leaders to do as champions in this space?
Thank you so very much. What should the religious leaders do? They should continue the good work that they have been doing, because we have our prophetic mandate to speak on morals and values. Anything that is harmful to our community, we should rise and boldly speak against it. As I spoke about captive audience, we have wonderful platforms in our churches, mosques, Hindu temples, etc. We should turn them into safe spaces where those people who are affected by these practices can find solace. And then we also have some privileges of advocacy. We are able to knock at every door. There are some religious leaders who have the president's phone number. They can call him up even now, and the president will pick it up. And so this privilege that we are enjoying, we should advocate for this worthy cause. And not that it's not happening, it's happening. And we should also, of course, collaborate with our partners and be able to raise funds for those people who are doing like what our brother Frankie is doing, or our sisters here. The religious organizations, they have the funds to answer such questions and to be able to advocate and be able to protect the underprivileged. And we have hospitals, we have schools, we have some media, radio, television stations. And so this could be platforms where, for example, the messages and the messages that will be crafted out of this forum, we have faith-based media where we can do pro bono, we can broadcast, we can do it for free, and we also, the religious leaders should come up with positive messaging, manuals and booklets or teachings, where in every occasion, at least the priest or the clergy can take 2 or so minutes to speak about the welfare of the children.
Thank you so much. The key message that I hear from you loudly is approaches to integrating child protection in the messages by the clergies and their different ways, and the aspect of that the opportunities for the practitioners in this room to collaborate with the church, and especially some of the opportunities that you've talked about, like the faith-based media. Messages we can use those platforms to do the messaging, but also building the capacity of the clergy to even create some time within their schedule to also talk about these issues. So thank you so much. So I want to create about 15 minutes for the audience to ask direct questions. So I want you to take a minute each coming from that side. And as you reflect on how do we then break the silence, and how do we ensure that these hidden practices, what is this that we need to do differently for them to be reported, for them to be recognized, and things like that. So in less than 1 minute, that would be like your parting shot before we hand it over to the audience to ask questions.
I think we should have zero tolerance on issues of harmful practices. Our law does not allow people taking advantage of others. And so when it's done, then we should have the law implemented. And these people, although we are trying to persuade them to forsake these practices, we should also be firm, because it's a pity that we are talking of FGM today. Why else we know it is of no value. We know it has a lot of repercussions, the same as bidding, etc. So I believe if we apply the law, it could be effective. But also, let the religious fraternity be bold enough, call out and shame those people who are advocating for this. And also, 3 points. 1, we must collaborate. This fight cannot be done by religious organizations alone. Then let's each one of us, number 2, take our responsibility. That we need to be like the hummingbird that did its little role to quench, or rather to put off the fire in the forest. Each one of us, we can take our role and try to bring these practices to an end. It is a shame at this hour and this century, we are talking about things that are passed by time, that are harmful, and we should have again In conclusion, zero tolerance. Thank you.
Thank you so much for that, Bishop. So, Naisia, 1 minute.
Thank you so much. I know most of you might be thinking, girl child bidding is the new thing in the building. But trust you me, it's not a new thing. It has been there. Girl child bidding, FGM, and child marriage are intertwined. And there has been practices that have been there since we were not even born. So why is it not being known? It's because probably it's not ceremonial as the way child marriage is, as the way FGM is. It's celebration, there is food being cooked. But when you talk about girl child bidding, it's not ceremonial. People don't dress in beautiful dresses, come and dance, Moran come and dance, and women coming and singing. And there are no also blessings that are associated when it comes to girl child bidding. In my community, FGM is associated with getting blessings from your father, in quotes. When you also talk about getting married, it's also associated you now starting a family. It's also a blessing. But when you talk about bidding, there is nothing in quote, blessings in quote, that is associated with bidding. So it tells you more, why is it more hidden? Why is it not being talked about? So we also need to create a lot of awareness that this is also against human rights. It's against the rights for children. It's also a thing that we need now to create more awareness and let people know that the same way they know now that the government is against FGM, they should also know that the government is also as well against girl child bidding. So more awareness, and more talking about it will make people know that we need to stop this. The same thing applies to the bidding. The way we are saying about FGM, in many villages, in the remote places of Samburu today, when you talk about FGM, they are doing it at night. They are doing it in the forest. They are doing it in hidden places because they know the law will follow them. They know that the government is against it. But when it comes to bidding, people are not talking about it. That's why they don't fight. They don't know even that the government is against bidding. So we need to create more awareness and also mass enrollment of girls to schools. That is the only way we can eliminate these harmful practices.
Thank you so much, Naisia. Josephine, less than 1 minute.
Okay, so integrating the efforts that we are doing. For instance, do you have the Ministry of Education here? Because education is the center of elevating the value of these girls. Whether in the village, whether in towns, in urban areas, education is key. The shepherd girls don't go to school. They are not allowed. Their life is just about herding and getting married. There's nothing else they are waiting for. So we need to integrate our efforts and responsibilities because my mandate starts where yours ends. So I think we just need to integrate what we are doing together as partners, as government, as agencies, so that when people come together, they are able to discuss these issues amicably and look for solutions. Funding is another area that is a limiting awareness. There is nowhere that I've seen funding for bidding. Maybe I'll come to you now that you've said yes. But there's no funding in some of these areas where we are seeing cultural practices that are not normally talked about. There is no data. We don't have organizations that are coming to get data, especially in those areas where such practices are prevalent. So we are also looking for data that is going to help us to look for funds so that these girls are safe. When you go to the field, some of us who have been there, and I know many of us who are here seated in this forum have seen these girls, have worked with them. Some of them hold your dresses because this is sex that is forced on them. They hold you. Please don't go. Because when you leave, they are waiting to pick her. And yet you can't live with this girl. So they hold on your dress. Please don't go. When you give them uniform, the next day you find it on the shelf in your desk. It was returned. Because the culture is so strong that the force that we are going with is too weak. Sometimes the police themselves cannot get into those areas because they know the dangers. It needs so much collaboration in some of these areas that you can't go alone. If my friend Lynette here goes, my colleague, and knocks on a manyata to check if why a girl did not go to school or did not appear, the person who is going to open that door is going to come out with a gun.
Yeah, thank you. Thank you, Josephine. All right, Frankie. When you see me lifting like this, it's because I want you to summarize, but just make it brief, because at least now we've got our colleague from Kenya National Commission of Human Rights, and we need to hear from the commission. So maybe if you can just say what you have to say in less than a minute.
Thank you. If we can be able to fix documentation, strengthen our health system, and work with our communities, then we'll be able to reduce fear, increase understanding, so that we can be able to save children from irreversible harm. People, when we are going to have tea, please, let's talk about this product. It is called Inclusefit. Inclusefit is a sanitary for intersex persons. You remember we have those children who are raised as boys because our parents saw the penis in between their legs, but they have the internal system purely for women. Sindio? When we talk about free sanitary to our going girls, please let us talk about intersex too, because they get menstruations. Thank you.
Thank you so much. Thank you so much, Frankie. Now, before we come to our colleague, Bishop has another engagement in Westlands and he'd want to leave. I want to check whether there's any one burning question to the religious leaders from the floor before he leaves, because I know yesterday he was supposed to be in. Yes, there's one question, please, from the child. Let's appreciate the child. Take the mic to the child there, please, Faith.
Hi everyone. So my question goes to Bishop Warari. Thank you for the panel. So what are the religious organizations doing to stop the harmful practices that are being carried by the religious leaders? For example, we had that case of Mackenzie. So is it that it's a harmful practice, but it's still carried out by a religious leader? So what are you doing about those harmful practices that are being carried out by religious leaders? Thank you. And also, the church or the places where the people go to worship has been like the headquarters of the bad cults that I talked about in the first day. So the question is the same. Yes, what do the organizations do to address those issues?
Let's appreciate those children. Those are very good questions.
Indeed, they are very questions, and really, my children, God bless you. Now, the church is crucified because of the Shakahola issue. And in fact, we have a commission that was initiated by the president, and they have come up with, there is a bill already in Parliament to regulate the religious organizations. Now, we have to speak the truth that in our religious organizations there may be some practices that are not right. Concerning Mackenzie, because these are public, it's in the public domain, I'm from the Evangelical Alliance of Kenya. 2019, we received report that Mackenzie is causing, or rather is teaching against education of children, and that the children should not, or rather his followers should not go for medical services. And when we received it in our rather in Evangelical Alliance of Kenya, we took a step and started investigating the matter. We sent 2 bishops to Shakahola, and the matter was picked up by the area chief, and it is documented. And Mackenzie was arrested, and listen to this, he was fined 10,000 shillings. After he was fined 10,000 shillings, when the case was over, he started attacking our bishops who raised the red flag. So was the church not proactive? I would say we did our best. Who failed? Is it the local administration? Is it the government? Because this happened, and it is documented. It happened 2019. And the case, the Shakahola saga, came up about 2 years later. So we did our part, and we are doing our part. The second part of the question that was asked, we've come up with a code of conduct document, which we launched last year. We, in the religious circles, we have what we call that kind of conduct, and we also have our umbrella bodies who regulate us. For example, if something abnormal is seen in Bishop John, because I have signed the code of conduct, the Evangelical Alliance of Kenya will summon me and interrogate my acts. And so all that is there. The Shakahola issue is not actually isolated case of the church, but I believe it was a criminal act of a criminal person called Mackenzie. And one time we had a sitting with the Attorney General, and he mentioned about some individuals that are not doing 1 or 2 good things. And he said the church is wrong. And we told him, even some of his officers and lawyers, we have rogue lawyers. That does not mean we can say all lawyers are evil. So, yes, thank you for your concern. There are harmful practices that were being done in Shakahola. We flagged it. And if there is any going on today, I'll be the first one to be against it and to rectify it if possible. And my dear audiences, I have another commitment being waited for by the UNESCO, and I have to rush in Westlands. But I can see Mama is raising up her hand, but she is going to ask a question. Now she's pointing at me, goodness gracious. Please deliver me, redeem me.
No, thank you so much. I think the message from the children is clear that the church, you don't need to be silent or quiet when there are practices that are happening within religious institutions that are actually harmful practices to children. I think that's clear from the children. Now, good people, I want to give Madam Janet Chepkirui, even as we release Bishop to actually attend to the other engagement. Thank you so much for joining us. Let's appreciate Bishop as he leaves. In less than, Bishop, there's a gift for you. Thank you so much. In 2 minutes, Madam Janet, Kenya National, the Commission of Human Rights has done work in terms of monitoring and documenting focused cases, especially on these harmful practices. So, and one of the things that we've been discussing here is that some of these practices, not female genital mutilation, but girl-child breeding, intersex genital mutilation, and then we talked about virginity testing and forced male circumcision, are still underreported and not very visible. What factors have you established from the Commission that are actually contributing to these practices remaining invisible, and what can be done to shift this? 2 minutes.
Good morning, and once again, I'm sorry for coming in late. I got some mechanical challenge on the way, but I had to make sure I'm here. So as you said, my name is Janet. I work at the Kenya National Commission on Human Rights, which is an independent commission that is, whose mandate is mainly to promote and protect human rights. So as the moderator said, at the commission, these harmful practices, we must say that these are a violation of human rights. It violates the right to dignity, it violates the right to life, because in some cases it even ends, someone might lose his or her life in the process. It also violates the right to education. We agree that some of these practices, once they have been done, for example, the female genital mutilation, it goes hand in hand with early child marriage. So in the long run, it actually violates the right to education. So as from the Commission point of view, these harmful practices they're not supposed to be anywhere in our society as you are speaking. So what are some of the reasons as to why, even though the Commission is open to receive these complaints, how comes that we are not getting many complaints as they are supposed to be, yet they are actually happening? One of the reasons is that there is that fear of stigma. For example, if you are coming from a certain community, if the community realizes that you are the one who has reported the case, there is that the community might view you from a negative perspective. You will be seen like one who is betraying the culture of the community. And so these things happen, but people fear to come out and report them. So one of the main reasons is that fear of being seen as an outcast in the community. Another reason is that there is lack of trust in the authority. Someone might say, yes, person A reported, but nothing was done. So there is need that when a case is reported, it should be followed, and the people who are concerned should be brought to books, and the right measures should be taken on them. Another reason that we found out is people do not know their rights and laws. Actually, if you go to areas, like for the last 2 months, the Commission has been going to 7 counties, which is the hotspot of FGM. And people don't know that FGM is illegal. They don't know that there is any act that was drafted that actually makes FGM to be a criminal offense. So there is that lack of knowledge. People do not know that some of these harmful practices are illegal, and they are actually punishable by our laws. And maybe because it's given me 2 minutes, I would also say that one other reason is poverty. The poverty levels are very high. And so if you are seen to be the one who is going to report this, remember, once a child has gone through FGM, that girl is seen that now is ready for marriage. And what comes with marriage? There's dowry payment. So some things like poverty pushes some of the people to actually carry out some of these practices. So some of the interventions that maybe we can do, or we have done as a commission, one that I would actually say is that the office is open for reporting and documentation. Remember that these are government institutions. So there we have you have the lawyers in the commission who will actually give free services. You don't have to say, oh, I don't have money to go and pay the lawyer if such and such a thing happens to me. The commission has lawyers who will offer their services for free. The commission also, for the last 2 months, we have realized that there is a gap maybe between the Ngao and the law enforcers in fighting some of these harmful practices. So what we did do, we have come up with a module there's a training that the law enforcers and the Ngao officers will go through just to be retooled on some of the things that they are supposed to do. So that is what I can say for now. But we say that these things are against the rights of children, against the rights of women, against the rights of the citizens.
All right, let's appreciate Madam Janet for sharing with us what the Commission is doing. Now, we're supposed to be doing the next panel discussion. So what I would request that we do is that we adopt the practice for yesterday, write your questions, and then have them. We will create some time in the course of the program to actually have the panelists respond to those particular questions. I'm promising that because, again, I happen to be the moderator for the day. So I would create that time. Please note your questions, and then we will create that time. So as at now, I would, again, want to appreciate the panelists for really sharing your experiences and giving us some of the recommended suggestions on what needs to be done to then have these currently hidden practices even more talked about, and I think one of the things that we may want to even recommend to government bodies that collect authoritative data like the KNBS is that we need to start including some indicators for these harmful practices for us to even start understanding what are the prevalences, what is the national prevalence, and the way we know, like we've got 22 hotspot counties for FGM and child marriage, and we're able to also tell what are the hotspot counties for these practices for targeted programming. So thank you so much. Once again, I really want to appreciate you. Please, again, let's give them a hearty clap for their sharing, and then request that Faith, you come and appreciate them. Then once we're done, Madam Vivian, please start coming up front. Thank you so much, guys. So now we are transitioning to session number 11, and our able moderator will be Madam Vivian. Let's appreciate Vivian even as she takes the stage.
Thank you, Fratemo. Good morning, everyone. So I have the honor to moderate the next session. And as we open this important session, allow me to just give a reflection on what this is about. In November last year, the government of Kenya went to Colombia and committed to end violence against children. In advancing these Bogota commitments, which is our next session, we are looking at building a unified front to end harmful practices in Kenya. We are reminded that commitments are only as meaningful as the lives they transform. So the Bogota commitments were actually born out of a shared global recognition that violence against children, and that includes child marriage and other harmful practices, are not inevitable, they are actually preventable. And Kenya has taken these significant steps in aligning at least our policy, our legislation, and national frameworks with these commitments. So the lived realities yet for so many children remind us that progress is just not made on paper. It doesn't always translate into practice. You know, you can have policies, very nice commitments, but how practical have we been in practicing what we have committed? So this session, therefore, will invites us to move beyond reporting progress, but also to interrogate the impact. We want to ask what is working, what is not working, what must we urgently change if we are to protect every child everywhere. So allow me to invite my panelists today. We have the government representative, Mr. Mwambi Mongare, to join me at the front. We also have Asenath Mithiga from the Brave Movement. I have Jackson Onyando from UNICEF. Karibu Bwana Jackson. A round of applause as they come. And I also have Yvette Kathurima from the Child Investment Foundation. Madam Yvette? No. Patricia Msenya. I'm sorry about that. Patricia Msenya from Girls Not Brides, Kenya. Sorry about that, Patricia. You're welcome. So to set the foundation of this critical conversation, karibuni sana. Allow me to sit here. So we begin with the leadership of the government. I kindly request the mic, the other mic, kindly. Thank you. So to set the foundations for this critical conversation, we begin with the leadership of government. The State Department for Children's Services actually sits at the very center of Kenya's response to harmful practices. I know that as the State Department, you drive policy, coordination, and national accountability for the protection of children. Mr. Mwambi, we request that you share with us the priority actions currently being advanced to actualize Kenya's Bogota commitments.
Okay, thanks, Madam Vivian. Good morning, colleagues of yours. My name is Mwambi Mongare. I'm a Deputy Director, Children's Services, State Department for Children's Services from Ministry of Gender, Culture and Children's Services. I'm in charge of child protection. Thanks for the question. As government, there is a lot being undertaken. First of all, it's good. We appreciate the creation of a State Department for Children's Services. Already that's a big elevation. Because when we went to Bogota, we were under State Department for Social Protection and Senior Citizen Affairs, which means even when you go for resources, you bid amongst other people, other sectors. But now we are a full-fledged subsector, and a lot is happening. And in Bogota, I think, for the best interest of those ones who are not aware, we made 5 pledges: the issue of parents and the caregiver support, safe and enabling school environment. Then we talk about the issue of response and support services to end violence against children. What we have been doing from Tuesday up to today, the issue of ending harmful norms and values. Last but not least, whatever we do, we make sure we have to monitor, we evaluate. There has to be accountability, research, and running, so that we make sure whatever we do as a country, it is being reported, and we make sure that we are safe, our children are safe wherever they are. So since November last year, a lot has been happening, but not as much as we anticipated due to other circumstances beyond our reach. But I can promise to the congregation that much has happened. For the first time, we have done our bidding for resources as a state department. At least we can see at the end of the tunnel. And we thank the development partners here, the civil societies, the public benefits organizations here who has supported us so that we seek for more resources. I think since I came here on Tuesday, and the main conferences I've attended and the workshops, the issue of inadequate funding. If there are no funds, there's nothing you can do. We pledged that they wanted to raise around 16 billion for child welfare fund. Up to now, we have been promised 2 billion, but with conditions. We promised a lot that we were able to do on the issue of parenting, National Positive Parenting Program. We need the resources. And for information, I think this is the first financial year as a state department or as a director of children's services would bring the issue of National Positive Parenting. Previously, it was under our former sister directorate for social development. They were the ones who were running that program. So we are running to do everything, get the resources. When we talk about the resources, both human and financial. On human, we promised in Bogota that we were supposed to raise the workforce by 50% per annum. Last financial year, we did 60 new officers. So again, this year, we are struggling whether we can get more officers on board, which we foresee that if the numbers of our officers increase, our outreach to the communities, to the sub-counties will grow. And that one needs the resources. Everything needs financial resources so that we are able to make sure that whatever we pledge to the whole world, and the moderator was my partner in crime, we got a standing ovation, so that we need, when we are going to report after 2 years, that we see that we have managed to achieve what we were supposed to achieve. And the colleagues from what I've heard from Tuesday, yesterday, much is happening, but what has been happening is lack of coordination, and we hope there will be a lot of coordination as a state department so that we come at the top and we make sure whichever bishop was here, what he forgot to pray for us is that those moral efforts, we bring them together and we put out this fire of dealing with harmful practice in our economy. You know, when a bishop prays, we were brought up in such a way, those ones who went to Sabbath school, Sunday school, madrasa, that when the big religious characters pray for us, things happen so that for the better of this nation. Otherwise, as a country, much is happening, and I think it's good that the members of the public are aware of that. Even when we go to bidding for resources, we used to go as one, now we have 3 programs. And in conclusion, I can say, whatever we pledged for, we are working towards achieving it with the support of many organizations which have come on board to collaborate with us so that we make sure, as the team leading this exercise, this activity, we achieve whatever we pledged. We have UNICEF on board, we have civil societies like the Joining Forces Alliance, we have the civil society, national civil societies like ICS, ROMOS, there are a lot of is happening. Without even forgetting on the refugee children, we have UNHCR on board. But I think in the past they were not on board the way they are now. So you can see there are good things coming on board as a new state department. So we work towards ending harmful practices in our country. That's what I can say for now.
Thank you, Mr. Mombi. Very clear actions there on resource mobilization to help us implement what we committed that we will implement. And maybe to just probe further, could you kindly also share in terms of programs on how far we are with the implementation, just apart from the resource mobilization? Have we been able to make any progress in terms of the actions that we committed to do?
I think, thanks, Madam Vivian, for the issue you have raised. As I spoke first, I said, on the issue of parenting, the National Positive Parenting, we are doing much, working with other civil societies. When we went to Bogota, we were in 2 counties. Presently, we have moved to more than 15 counties on the issue of National Positive Parenting, working with the ICS, CSP, RUMOS, and other collaborators who have come on board. On safe and enabling school environment, much is happening, that now the use of positive discipline is being encouraged everywhere, or what we call alternative discipline is being encouraged everywhere. The issue of those girls who are dropping out of school, you know, remember we have a guidance on that. Already that one, we are working towards it. And I think before the start of this financial year, that's in the month of July, our principal secretary met the CEO Teacher Service Commission, because the teachers are the ones. You have been asking, where is education? I'm wondering, nobody has asked. Education is not the end of it. Where is the TSC? The TSC is the one which is in charge of teachers, who are with our children almost 3/4 of the year, because you are with the children for only 3 months, 3 to 4 months, but the other 8 months are with the teachers. So a lot of things are working. Have come up with the issues to make sure that our children are safe wherever they are. And we pledged, even the Minister of Education, Teacher Service Commission, pledged to train the teachers so that they make sure that there is a safe environment wherever our children are in schools. On the issue of response, I think we promised that we, as a country, we work towards making sure there's prevention and reporting on violence against children. I think that one is happening. Even through our CPI, Meta Child Protection Information Management System, a lot of things are happening. The issue of participation of our children advisory committees, formerly called advisory councils, we have made sure that in every sub-county where we have a children officer and a deputy county commissioner, those structures are in place. And on the issue of ending violence against children, this convening is one of the processes. We are doing a survey on harmful practices. The issue of male engagement, I think I'm happy, I can see Tony, the issue of male and FGM, where you find is the men now. You can see that's a lot of, and like in the past, men who are not informed in this case, even ending child marriage, men have come out very strongly. And we have already developed a strategy and the guidelines to end harmful practices. So you can see, colleagues, the government is doing a lot in collaboration with all stakeholders who are in the room and others who are not here. That shows that there is a lot of confidence. And the leadership of the State Department. I think on Monday you saw our principal secretary open this meeting. She is a mother, she has passion for children. And we are happy that now we have somebody who can speak for the children. And I can share with you the footprints, both print and electronics he has left behind, is a very big mark. I think a lot is happening.
Thank you, Mr. Mwambi. I like the emphasis on in collaboration, meaning that it is not only a government effort, but we are collaborating with our partners to ensure that these actions are actually implemented. This conversation has actually brought together not only government, but survivor-led movements, civil society, coalition, and development partners. And you can see this is very deliberate, because ending harmful practices demands that we have a unified front, and that is why we are here. So my next panelist, Ms. Asenath Mwithiga, we want to move from policy leadership, and we are now turning to the voices at the heart of this movement, and who are the survivors themselves. So, and survivor-led organizations actually remind us that accountability is strongest when shaped by lived experiences. So, Madam Asenath, kindly share with us how survivor-led organizations can strengthen accountability for the Bogota commitments. And in addition to that, because I know you have a commitment elsewhere, you can also share on the lessons from the global survivor movements that can guide Kenya's next phase of implementation. Thank you.
Thank you, Vivian. Good morning, everyone. Good morning. Thank you so much for having me, and by extension, the Brave Movement. My name is Asenath Mwithiga. I'm the Deputy Director of Brave Movement. The Brave Movement is a global movement working with survivors and allies, and our work is on ending violence against children and adolescents, and that is sexual violence against children and adolescents. And we do that through prevention, that is by ensuring that children are not violated, they are free from sexual violence. We also apply the healing approach, whereby working with adults of childhood sexual violence, ensuring that we provide psychosocial support, trauma, safeguarding and mental health, so that they can be able to heal from the violence they underwent while they were children, and also through justice, ensuring that there are mechanisms or opportunities for them when they are adults to be able to seek legal counsel when they are in their adult stages. So that is who the Brave Movement is. If you're not a member of the Brave Movement, I would highly recommend and encourage that you go into our website, bravemovement.org, and sign up to be a member, so that we can continue building this movement. Now, on to the question about survivors. Before I go to that, and thank you so much, Mr. Mwambi, for the conversation that you have started as the government. But I'm just wondering, in this room, how many of us are aware of the Bogota commitments that were made last year? How many of us, by show of hands, how many of us are aware of the commitments? This is a public document. I would encourage all of us to be able to access it, because most of us, if not all the organizations represented here, are working with survivors. So for us to be able to check and hold the government accountable, we have to be aware of the commitments that the government made. As Mr. Mwambi has mentioned, the parent and caregiving support, there are a number of commitments that the government has made. Safe and enabling school environment. I know most of organizations here are working with children in schools. This is just but context. Response and support services, a number of commitments as well, ending harmful norms and values. Most of the conversations for this convening has revolved at that. And then monitoring, evaluation, accountability, research and learning, there are a number of commitments. So I would really encourage all of us, because all of us are working towards the same vision. If we could really interrogate some of these commitments, and therefore then I can delve into my questions, because if we are talking about accountability and ensuring that the government is, implementing or ensuring that it is honoring the pledges and the commitments that were made, it's only through by us being aware of those commitments in the first place. So survivor-led organizations, they play a critical role in ensuring that we are holding, and we are working together really with government and really checking if these commitments are being put into action. For me, seeing a department for children's services, it is kudos to the government, because for the longest time we have really called for this department. So we are grateful for the government of Kenya for giving us some of these state departments. And then the other thing is ensuring that we are collaborating, because the government to ensure that some of these commitments have been trickled down to the lowest levels of governance. Even as we are talking about devolvement, some of these commitments is also ensuring that we are having the lived experience experts, the survivors in these decision-making platforms, that when you're planning the surveys that you're talking about, that having the survivors included, even as the indicators are being, formulated, when the government is planning or programming, that the decision maker, that the lived experience experts are contributing the expertise in some of these programs and policies. And that is why in my opening remarks on Tuesday, I talked about a survivor council, National Survivor Council, where the youth and where the survivors are part of the decision making, so that they can also inform out of their lived experiences. And also, how can survivor-led organizations continue to strengthen this accountability is then ensuring that we are utilizing the data and evidence that is being published around ending violence against children, and then therefore this would strengthen conversations, that we are programming from a point of no, informed the data that is being collected. And it is us, the survivor-led organizations, who can also play a key role in terms of research, in terms of contributing towards this data so that we can enrich the entire ecosystem. To your second question, Vivian, about the lessons from global survivor movements and how can they support the government of Kenya and Kenya basically in this implementation phase. There was a lot that was discussed yesterday about co-creation and how does co-creation look like. So all of us have to be involved in the process of co-creation if we have to have tangible programs, sustainable programs. So as the government has invited all of us in this room today, and I'm really happy that we are having these conversations, these convenings, let it not stop here. Let it be continuous, and let us look for ways that we can be able to sustain it. It's not just at the national level. Let us also go to the counties, because we know data that there are so many counties that are adversely affected by, child marriage. There are counties that when you go to them, the dropout of girls is at a high. So how do we ensure that we are doing co-creation, not just at the national level, but also at the community levels? The power of storytelling, having survivors speaking their truth, having survivors leading their conversation and telling their stories. We talk about stories having power, so why not ensure that we are having that transformative power of storytelling and ensure that we are shifting the narrative, because these are all issues around harmful social norms, and for harmful social norms to be alleviated, it takes a lot of time. It is not a one-off. We are talking about change of attitudes and beliefs. And for us to be able to do that is to have stories being told and contextualized in different communities so that people can be able to understand. And maybe the other one I would want to mention is ensuring that we are building alliances, that we are working together and not working in silos. And that is the power of the movement, that when we come together and we are all chipping in our areas of our niche, then we are able to alleviate violence against children. I thank you.
Thank you very much, Asinath. Asinath has been very candid in highlighting that the government has given us the conducive environment and the need for us to collaborate together to ensure that the survivor or the Wanjiku gets this information, and also the power of the voices. And maybe to just reiterate, it's just not storytelling, but it is actually sharing the actual stories, of what survivors have been able to go through. Thank you very much, Asnath. I'm moving on to the power of coordinated civil action. Patricia, from Girls Not Brides Kenya Coalition. This coalition brings together partners across the country who amplify advocacy, strengthen coordination, and drive collective impact in ending child marriage and other harmful practices. So Patricia, kindly share with us coordination and advocacy approaches that have most effectively advanced the Bogota commitment so far. Thank you.
Yeah, thank you, Vivian. And thank you, everyone. Good morning. Good morning once again. Yes, my name is Patricia Macau, and as Vivian has rightfully introduced me, the evidence and research lead with Girls Not Brides Kenya. And Girls Not Brides Kenya is part of the global partnership that is Girls Not Brides Global, which is a partnership that works towards ending child marriage through various approaches. And here in Kenya, we are a partnership of over 200 actors who are working towards ending child marriage and other harmful practices here in Kenya. And therefore, I call upon you, if you're working towards ending harmful practices and child marriage, to join us. We are a movement here in Kenya. And I'm sure several or almost all of us here are working around these issues. So you are welcome to join this movement. To the question around coordination and collaboration and advocacy around ending violence on children. Yes, when it comes to advocacy, we must admit, and through experience and through evidence, it's a common thing, or it's something that has come to the fore, that collaboration is a must. No one single or individual organization or an individual can carry out advocacy on their own successfully. We need coordinated, collaborative efforts to be able to advocate against harmful practices, violence that is meted against children. And in this case, I will talk around the collaboration that is there. And I think we are living the evidence of collaboration, and I must applaud the State Department for Children's Services for convening such a convening. This is one of the platforms that espouses the aspect of collaboration, because it has brought in different actors. We have the civil society and we have government actors around here. And it's only if we do collaboration, if we come together, put efforts together, that we can be able to make any positive impact towards advocating against violence on children. And also, over the period we've been here, I've had over and over again us bringing to the fore the aspect of the importance of multi-sectoral collaboration. Like, for instance, for us to be able to end violence against children, it's important to acknowledge that we have different sectors that all play a part towards ending this violence. We have the education sector. It plays a very big role. So if we are to end this violence, we need to involve the education sector. We have the health sector, right? We have the religious leaders. We've seen them here. And even the previous speaker, the bishop, called out for collaboration with other actors. We have the civil society, the government. We have all these different sectors, the police, the justice system, and all that. We have all these sectors that are very key in ensuring that we advocate against violence against children. Also, as we do advocacy, just picking up from where Asenath has left, speaking around survivor-led, and also the aspect of there's nothing about us without us. So the children need to be involved. The participation is very critical. So for us to make any positive impact towards eradicating or preventing violence against children, we must involve them. Let them shape the discussions, let them shape the policies around their protection and ending these harmful practices. The other bit is there is importance to acknowledge and involve the regional and even global influence. Because, like for instance, a country like Kenya, like the Bogota commitments, these are commitments that we've made that are global, that are able to push national commitments to be implemented, to be actualized. So we must acknowledge that the importance of regional and global commitments in advocating against violence against children. And in this case, we are looking at like right now there is a campaign on the Africa Year of Education, which is very critical in advocating and ensuring that children are protected. We've seen how education is very important. When girls, boys go to school, the harmful practices or the violence against them is reduced. There is evidence against that. There is the Agenda 2063. Another commitment coming from the Bogota commitments that Kenya is really upholding is the AU accountability framework on ending violence against children, which is also a regional mechanism that would help also in influencing advocacy against child violence in the country. Thank you.
Thank you very much, Patricia. I like referring to advocacy efforts as necessary noise, you know, and for us to make necessary noise, we need a unified front. We also need evidence and accountability mechanisms, as you're saying, because we need to ensure that those who are responsible are accountable. And I also like how you are emphasizing on the need to work together, because in as much as we are independent actors, we can come together in coalitions such as Girls Not Prides and many more to just ensure that we amplify our voices, to ensure that whatever we have committed to do, we do it effectively. Thank you very much, Patricia. And I now turn to the agency that has stood with children alongside the government for a very long time in advancing child protection systems, and that is UNICEF, and translating the global commitments into national actions. We appreciate every effort, UNICEF. So Jackson, I request that you share key shifts needed to accelerate Kenya's implementation of the Bogota commitments, and then we'll come back to the next question, so just focus on that first.
Thank you very much, Vivian. Good morning, colleagues. Good morning. Yeah, there are many shifts that we need to make, but if I will just summarize it, is actually, Vivian, what you said. Progress is not made on paper. Progress is made by these colleagues and the actions that they do on the ground. I missed yesterday, but I'm sure there was a lot of learning on grassroots interventions that happen. We live in a very nice country which has almost everything. Almost everything. You go to meetings and countries really struggle, but for Kenya, when you just ask, you'll find there's a document that exists about that particular thing that you're struggling with. So for me, it's not doing anything new. It is strengthening what we have and actioning. Yeah. So the first thing in terms of shifts will be, and I'm reminded of the process of us developing these commitments last year. There was a whole of government approach towards this. The development of these commitments, you could have 5 permanent principal secretaries in one room, agreeing health, justice, that time social protection. So the first shift for me is, can that momentum continue? How often do these PSs or the technical teams continue to meet to monitor the progress that we are making as a country? So coordination within government is something that I will not say is something that we need to establish, but we need to strengthen that multi-sectoral coordination, especially amongst sectors in health, because we have commitments in health about CHPs and all, part of Bogota. In education, as my colleagues have talked about, in gender, and justice sectors. Tied to that is at the national level. But we also have Kenya is a devolved, we have a devolved setting. We have the Children Act that has also established some structures at the county level. How many of our counties have the county children advisory committees active, meeting, right? So if they can be active on the ground and then they feed onto the national TWGs that we have, that would be great. And that also includes the subsectors, Vivian, the education subsector, the gender subsector of the TWG that we have. The second shift for me is enhancing accountability, and colleagues have talked about accountability. But how do we enhance accountability? Accountability is putting everyone on check, right? You said you'll do this. Are you doing it? Are you on track? And I think data can really help us to do that. Apart from DHS that comes after every 5 years, that gives us the survey data that goes to households, how do we make ourselves accountable with the incident data? Because child marriage happens every month, right? There's no month that we've set aside for child marriage. So it happens every month. How accountable are we in terms of the incidences, so that we're not waiting for 5 years to get survey data? We have Child Protection Information Management System. We have Kenya Health Information System, DHIS. We have Gender-Based Violence Management Information System. Do these systems communicate with each other? Do they? Right? We were told in this forum that 240,000 adolescent girls got pregnant last year, according to the National Syndemic Diseases Control Council. I think that number has come down because you used to work with 350,000. But how many of those, because those are children, right? Those are defilement cases. How many of those cases got into the Child Protection Information Management System? So using data for me and the systems that we have is another shift that we need to focus on. And then the third one that my colleagues have talked about is targeted investments towards prevention. We are glad that we have a State Department for Children's Services now this year, hoping that it will now have a budgetary allocation of its own that will be targeted for children. But for child and protection in harmful practices, we're not just looking at resources that come to the State Department. We're also looking at resources that go to education, that go to health, that go to the justice, judiciary, witness protection, and all that. And then we'll be able to analyze and see, in terms of protection, how much of allocations go to that. And it's just important to appreciate the problem. We have 4 children officers looking after 100,000 children in Kenya. 4 children officers looking after 100,000 children. So that tells you the gap that we have. And then finally, and I started by saying we have a lot of things, good things on paper. So we have some of the best laws, progressive, starting from our constitution. Can we strengthen the enforcement of those laws? Yeah. My colleague from the National Commission on Human Rights said they went to some places and people are not aware that FGM is illegal. Right? That's what she said. And FGM in Kenya has been illegal from 2011, when we, I think even, I don't know if it's the 2001 Children Act, yeah? So can we work hand in hand with communities? Because as we also saw on Monday, law enforcement on its own is not, it has to be accompanied by engagement of communities as well. But then Asenath has also talked about survivor-centered justice. When we take the perpetrator to the process, justice process and we get a conviction and things like that, do you ever come back to think about the survivor? Yeah? The damage was done. They dropped out of school. If it was FGM, it was permanent. Do you ever also think about justice for that survivor? Do you ever think about programs that need to take them back to school? Alternatives, I think someone asked on Monday, what are the alternative learning pathways that this girl who dropped out of school and is willing to go back to school can be assisted to? And then we recognize those certifications. They're able to get a certificate out of the alternative learning that then ensures that they get access to other employability or other skills. And then finally, the last one for me is we are also seeing pushbacks. We make progress, but communities also evolve, right? So we also need to go back to those communities and challenge those pushbacks. Where we are having medics, people moving from a type of FGM, for instance, to a type that they think is less severe, how do we address those? Where we're having people moving from traditional cutters to medicalized FGM, how do you do that? That young boy talked about religion, where the church, the congregation, the places that we thought were safe havens are also, being sources of perpetration of harm. I think we also need to look at that.
Thank you, Jackson. And in the spirit of managing time, and maybe to just sum up what you have mentioned, I had data, I had accountability, I had collaboration, coordination. Very key, insightful ideas there on how we can shift this. And I want to come back to Mr. Mwambi to just also pick your thoughts on how we can make this collaboration stronger. Besides what Jackson has mentioned, how do we ensure that our collaboration with counties and partners is stronger, and where is it most needed?
Okay, thanks, Madam Vivian.
In 2 minutes, kindly.
And I need even 1 minute, but because you are given me 2, I will use them. I think it's good I bring to the attention that anybody listening to me. I don't know whether you guys, you are aware we have 48 governments, one nation. Are you aware about it? Or you talk about my county government and everything. We have 48 nations, 48 governments, one nation. 47 county governments and one national government. When you come to the issue of resource allocation, it is 65% to the national government, 35% to the county government. So governors have a role to play to protect our children. The national government has a role to play. And for your information, if you go to the Constitution, on children issues, you will see it on Article 14, 17, 53, Article 260 on the definition. But when you go to functions, children don't appear in the functions. Children issues is a service, but not a function. Because if it was a function, they could have been decided either national or county. I think I'm creating awareness to you. So that when you leave this convening, you understand that children issues is a service. So you cannot say that this is a county child, this is a national child. All governments, the 48 governments have a role to play to make sure that our children are safe. On the issue of collaboration, whatever we do, I think you have seen from Tuesday, yesterday, and today, there is a need that to understand that it is each one of us, I repeat, each one of us seated here, outside there, listening to us online, that we have to be involved to care and protect our children. You cannot say it is the responsibility. There are those people here. Mr. Jackson tells me in the role, this is the role of government. Even himself from the United Nations bodies, they have a role to play to protect our children. So when you come to issue of policy, legislation, strategic plans and annual work plans, we make sure everybody is brought on board without leaving children behind. Even when we're the Children Act, the Cap 141, we informed the children. That's child participation. It's one of the pillars mostly ignored. When it comes to policies in the counties, we have to make sure children are involved and everybody in that county is involved, because we are supposed to make sure that our children are safe. I think I've heard from my fellow panelists, we have a lot of papers, registration, policies, work plans, and everything developed in Kenya. There is only one undoing is implementing. I think we can agree. Some people come from outside this country, they come look at our documents, they copy and paste, and they move on. They don't go to ban the media the way we have done. We have a lot of documents developed. Like I've heard my colleague asking, how many of us are aware about the Bogota commitments? Even some can be asked, how many of us are aware that in Article 179 of our Constitution, there is the County Executive Committee, which is the head arm of every county government. Because some two people in 2010, they read for us the Constitution. The third president and the former prime minister. So we need to be very careful. Let us read these documents for the best interest of our children, so that we make this a lot of collaboration. We make sure whatever we do, each stakeholder, please, you have a role to play. I'm happy with what the Bishop said, or already said, the hummingbird. Our small roles have a very big role to make sure that our children are safe wherever they are. Thanks.
Thank you, thank you. He has insisted that we need to involve the children, so more of child participation, and that also county governments have a role to play. It is not only a national government's role. And moving on to Patricia, what more do we need to do at community level to accelerate prevention? Patricia, you have 1.5 minutes.
All right, yeah. Well, at the community level, this is where all this happens, right? Yeah, and we need to move action to that level. And one of the things that stands out at the community level is the aspect of social norms. When you listen or you ask communities, why are you practicing this, right? They will say it's our norm. And we need to understand what is a norm? Why social norms? And when you look at it, is that norms is what individuals, the community members, are born into. When they were born, that is what they found. They have grown into in it. That is their normal. They do not know any other norm. But does that mean we need to stay in there? So for us to understand why these harmful practices, which in reality are violence on children, is for us to understand the social norms and what can we do about it. What can we do to turn around these beliefs, these traditions that communities hold so dear to them. We need to understand why do they hold it dear to them. For instance, we go to communities and we hear stories that it's the women who want their girls to be circumcised, to be cut, right? We've just heard here about the beading. It's the mothers who collaborate with the Morans to beat their children and help them to be booked for sexual activities. Why is it important for this woman? The other bit is why is it important to the elders, to the community leaders who are so influential, and what can we do to turn this around? So we need to inform them, create sensitization, make them understand why these practices we are doing, some of them may not understand why they're so important, and for others we look at it and we are wondering, why would someone advocate for something that is harming a child, another person? But we need to make them understand, be informed of the harms that they cause, the harm that they cause, the laws that are in place in the land around these harmful practices. Like we've had, some of the members do not know that there are laws that act against these harms. We need to do sensitization to all these different categories of community members, to men, women, girls, leaders, church leaders, and all that. Then the other aspect at the community level that we need to look at is economic empowerment. We've seen that poverty is one driver of these harmful practices and violence against children. So we need to also work around ensuring that these communities are empowered economically. We have different approaches to make sure this is achieved, so we can do that. Then there's the aspect of strengthening systems around child protection. Like, for instance, in our communities, what systems do we have around child protection? If a child has been violated, if there is any, violence against any child within our communities, do the community members...
1.5 minutes, Patricia is done. Wind up, please.
Let me wind up. Do the community members understand the systems that are in place? Where do they go to report? What needs to happen? Do they know that there are court user committees that they can report to the chief? Do the chief understand the systems and the mechanisms that are in place to protect the children? The children officers, like my colleague here said, there is 4 children officers for every 100,000 children. Those are things for us to look at in this aspect. Thank you.
Karibu. Thank you very much. There is need to enhance our community awareness and sensitization, as well as empowerment. So to Jackson, maybe you can, just briefly, kindly, because we are standing between the audience and T, to tell us the tools and approaches that can strengthen prevention and response systems so that our commitments deliver real, measurable results for our children. 2 minutes, kindly.
Yeah, I think as I started saying, we are a country that has actually everything that we need in our hands. So I would say the first tool is just taking advantage of the technology and the digital space. How much can we do online? We are the country that invented M-Pesa, right? That is now used globally. How much of that can we use in terms of technology to even do reporting? Can we have a platform where we can even do reporting online? We have the 116, which is the child helpline. And we are struggling with decentralizing it into the regions. We know it has capacity issues in terms of staff, but how much can we use the online space? We have tools that even give counseling and chat bots and things like that. So I think for me, it's really capitalizing on the digital footprints that we have in the country, including within government. And then for budgeting, and colleagues here do a lot of budget advocacy in your counties. You work with your county governments advocating for increase in budget. But if the counties asked you, how much do you want us to allocate? Yeah, assuming resources were unlimited, right? And the governor asked you, how much do you want me to allocate for FGM? Will you have an answer? So that has to be accompanied by some investment case. So we need to work with these governments to develop budget tools. I know many of us know about the cycle. The announcement is done on this day, the Treasury does this, but what goes on in that budget making process? So do you have the necessary tools? Have we done studies to show for us to avert 10% of FGM, we need this amount of money? So I think for me it's really, and also to demonstrate to them the cost of inaction. If you don't put this amount of money, in 10 years' time, this is what will happen to our county, or this is what will happen to our country. And then lastly, Yeah, I think those two. Something is escaping my mind.
Okay. Thank you, Jackson. A round of applause to all the panelists. And as I conclude, I think one of the things I hear most all the time is the fact that a child has been violated somewhere and our reporting systems fail them somehow. Because it is true that a child always tells somebody. But now, does that someone advance it? Even before a child is undergoes FGM or is married off, there's somebody who is aware of what will happen the next day. Probably the child, even if they didn't know or have heard about it, they told somebody. But what action did the next person take? We normally tell the nearest responsible adult, because they may not know where our offices are, but they say something. Our digital tools are available. We have emphasized on that, but we are still the same audiences that are saying they're not safe for our children to have or consume. So what happens to those children? I want to thank my distinguished panelists for those very wonderful insights that we have had. We continue to advance the Bogota commitments as a country. We demand that not only should we align it with our policies, but also purpose, and that our resources should be aligned and accountability across the national government and the county government. So as we leave this room today, the real question is whether the commitments are sound, is not whether the commitments are sound, but whether our collective action is bold enough or coordinated enough or urgent enough to face and match the reality that our children are facing. We want a Kenya where children are protected, empowered, and are free from harmful practices. Thank you very much. Another round of applause.
Don't leave yet. Let's give them a better clap. Thank you so much. Thank you so much. Thank you. So, like I said, we will create some 15 minutes, maybe after lunch, to ask any questions to session 11, and now, session 10 and 11 actually. We will create those 15 minutes. So please document your questions, because I know a few of us have got those questions. Some have even passed the questions to me, so please document those particular questions. So it's now 11:22. We take a 25 minutes tea break, and then 11:50 we transition to session 12. So all right, as we take tea, there is a QR code on our screens, which then gives you access to the feedback form for this convening. Please scan as you go out, even as you're queuing, waiting to serve your tea. You can take a few minutes to provide feedback. The QR code is on that screen, and another one on this particular screen. There is a paper again going round. Ensure that we do that. So tea is blessed. 11:50 we start. I'm being told that those guys are watching online. We'll also share the QR code with you guys. And for the online followers, if you have a question, put your question there. I will make sure that your question is passed to the right people. MS Winnie Nyandigo, are you there? Okay.
I'm standing on the capacity of a partner of the Five Foundation, whom we work and co-created together the resource for activists in Kenya and Tanzania. Can you kindly take your phones and go through the link, www.resourcesforactivists.com. It will lead you to the resource bank that was created for us, to enable us understand and articulate the issues within the communities on an evidence-based issues. So I'm really privileged for us to have this discussion, and I'm inviting all of us, funders, actors, and also researchers to work with us on this and also ensure that we go through it together. This resource bank was to support the grassroots organization, because it was co-created by 62 grassroots organizations in Kenya and Tanzania. And it was more of co-creation that we had to listen and design with the communities on which are all those interventions. Because many times you listen from yesterday's conversation, we are so keen into what has been happening over the years, but not also appreciating the times and also the milestones that we've made as a community and also CSOs. So this is more to give understanding, especially for us as grassroots organizations and also funders in the house, that what are those things that are happening or are the solutions towards ending harmful practices. Slide one. So we really focused on solutions, and solutions, you realize that from the panels that we've had since Tuesday and also yesterday, there is a big investment and conversation around education, because through education we are sure that girls are kept in school 100%. If not 100%, at least 85%. But then you find that, go to slide 2. You'll find that many times we look at the low-hanging fruits. Investing in a girl's education is not just an easy thing, but many times it's also about ensuring that they stay in school, and this is something that most of us do not want to invest in, as much as we speak about keeping girls safe in school. So with this resource bank, you will see that there are several approaches that we look into with the various organizations, and the key approaches are around education. We have economic development. We also have issues SRHR, scroll. We have issues SRHR. So these are the key issues that came out, that if we invest, we'll be able to keep our girls safe. And when you talk about, let me say things like economic development, you'll realize that in many households within the community, a woman who is empowered economically keeps her child safe, because they have the voice to ensure that their children are safe all through. And girls that are kept in school will give, for example, one of the partners who are there, Samburu Girls Foundation. They support girls through education. And also we have Pastoralist Foundation, which also say that keeping girls in school ensures that these girls are safe. So even if you go through the website, the link that I gave you earlier, you realize that we went ahead and costed how much do we need to ensure that a girl is safe in school? How much do we need to ensure that a mother within the community is economically supported, or is able to support herself and her family if we give them a startup capital? So from the resource bank, you'll realize that we have a costed measure on how we are going about this, and also issues SRHR. Many times when we speak about FGM, we speak about child marriage. We don't look into the underlying issues of this FGM. You'll find that many conversations we have, it's about how the cat started, how the cat is a cultural practice, but we are forgetting that over the years, from 2011, 2010, 2015, the practices that were happening in 2011, and also the work that we have done, in between 2015 to now, we are not having the same conversations. We have organizations who have ensured that girls are in school. We have organizations who have ensured that there is economic development that is taking place. And also with the shrinking fund, these are the issues that we are looking for long-term sustainability for the communities. So are we able, as a community, to ensure that we move from pity party for the community and dwelling into the cultural practices, but more of supporting the communities with the solutions and the innovations that they feel work for them? Because we are always speaking about how the cat started, types of FGM. Guys, we are in 2025. Let us embrace the changes that we have made. Let us embrace and also speak to our funders, our partners, to ensure that they are able to support that which we feel it is really working. I will not take much of your time since we already have the link. Maybe you can just take your time, go through the link and see what the entire resource bank entails, but more especially we call upon partners, the funders, the donors who are here, as people who are working at the grassroots. We are not looking for donors, we are not looking for funders, we are looking for partnership. It is one thing when you partner with us and understand and listen to the community, and it's another thing when you come as a donor and a funder expecting that your way should work for the community. Thank you.
All right, thank you so much. Let's appreciate Magdalene. A very good solution from Migori. And the intention for this is, of course, there is the aspect of giving you the opportunity to ask questions, to want to learn more. But like we said, is that one of the reasons as to why we are here is to connect. So should you be interested in a solution like what Magdalene has presented, take time to have one-on-one conversations like what we already were told in the morning, that there are people who already planned an exchange program in this coming month. Is it coming month or coming week? In January. So that's really the spirit of that. So having said that, I would want us to now go to Tony, Men and FGM, for a documentary. So Tony says he wants to say something before the documentary. So Tony, you have a maximum of 12 minutes.
Thank you. Good morning. My name is Tony Mwebia from Men and FGM Foundation. We are going to watch some testimonials from men trained way back in 2020 and 2021 and what they have been up to for the last 4 years. And this is collaborative work, not only Men and FGM that works in those communities, other organizations work there. So, and these men have been trained in partnership with several organizations. Some of them were going to be showcased from Isiolo. It was done in partnership with Child Fund, some with UNICEF in Wajir. Then we have Kajiado with World Vision and UNFPA. We have trained with so many organizations. So it's not just Men and FGM, but just to showcase that engaging men and boys really works when it comes to ending FGM. Thank you.
What is happening?
To engage, challenge. Back in 2020, we began a bold journey to engage, challenge, and awaken men in the quest to end FGM. Across 11 counties in Kenya, we met men who listened, learned, and chose change. Today, that journey continues, stronger, louder, and more united than ever. Today, we reflect back on what was, what has become, and what the future holds. On our mission to awaken fathers, brothers, and sons, from village gatherings to open dialogues, we touched hearts and opened minds. Many stood in shock, confronted by the reality of FGM. Now, the journey takes us to Isiolo County, to the home of Abdul Rashid, as he shares his side of experience. Mzee Abdi, a trained male champion since 2020, welcomed us with warmth.
But I'm a father to 4 girls. 3 boys, 4 girls right now. Mimi mwenyewe nimeonelea kwamba mambo ya ukeketaji haiko hata katika dini. Kwa wale wasichana ambao wamefanyiwa ukeketaji na wale ambao hawajafanyiwa, kuna tofauti kubwa sana. Kuna madhara ambazo yametokezea kwa wale ambao wamefanyiwa ukeketaji. Kitu cha kwanza, wanakuwa na scar, alama pale, na wakati kujifungua inakuwa shida sana kwao. Lakini wale ambao hawajafanyiwa ukeketaji wako sawa. Mimi mwenyewe ningependa kuoa. Right now mimi ni polygamy, niko na wanawake 3. Nikipata yule ambao mwili yake haijaguzwa, dini yetu Islamu inaruhusu kuoa 4. Unaelewa? Kwa sababu ukioa yule ambaye amefanywa ukeketaji na yule hajafanyiwa, they are two totally different. So tunafaa kuiga mfano wengine wale ambao wamepiga hatua. Kwanza nasema shukrani kwa Mola, to the Almighty God. Zile community wale ambao hawajafanya, tunasema pongezi kwao. Lakini community yetu kwa miaka kadhaa tumedhulumu wasichana wetu, na Mungu atusamehe. Na kama ingewezekana, nimesema niko na 3 wives. Yes. Kama kungekuwa na sheria kupeleka in-laws kotini, ningepeleka those families, kwa sababu wamenyima raha na wamenyima hata msichana yao. Unaelewa? Lakini katika kimila ya Afrika na hata dini huwezi shtaki in-laws, kwa sababu it was not their wish. Yeah. Labda ni wameambiwa ni dini, wamepotezwa, wameambiwa msichana wao ataridhika, wamepotezwa. Hayo yote tunasema no.
During his recent engagement, we met a courageous survivor, a woman who bravely shares her story and those of many.
Ukeketaji niko na madhara mingi sana, ikieleza kupitia hiyo process. Baada hata wakati unaolewa, siku ile unaolewa unapata bwana, unaingia nyumba, unapata shida kubwa sana. Ile shida ya kwanza, unataka bwana wa mapenzi. Shida ya pili, hiyo mwanaume ataingia wapi? Roho umeshona imefungwa. Nani atafungua? Kwa ni usiku, hakuna operation, hakuna mawaidha mengine, hakuna kitu kinaweza kusaidia wewe. Unang'ang'ana, hata hiyo mwanamke kesho atake hata kukuona.
Madam yangu, mke wangu, mnaambia unajua nini hii ndio madhara ya FGM. ABCD ndio hii. Mbona tutese msichana wetu? Unaelewa sasa? Mbona tutese? Si wao pia waenjoy life vile wengine wanaenjoy. Hakuna maandiko ya dini hapo. Hakuna mila iko pale. Hii ni mila imetoka kule Egypt wakati ya Farao. Sisi Waislamu tunachukua hivyo. Wacha kule Middle East, si tunasema imetoka kule upande Egypt. Hiyo imeletwa na Farao.
With the practice often linked to religious beliefs, we knew it was vital to engage sheikhs and other faith leaders led by Sheikh Hussein Mahad Noor.
So we are looking at the FGM from cultural perspective and also from religious perspective, and we articulated to the audience that FGM is not a requirement. Islam, although some Muslims use some religious evidence, but it doesn't go to the extent of causing harm. So we emphasized that it is good to stop this practice, because there's no religious script which emphasizes on it, and also it goes against the laws of Kenya.
From Isiolo to Nairobi, and now the journey leads us to the beautiful hills of Kisapuk in Kajiado County, where we meet the chief. Back then, his stand against FGM was met with backlash, but his courage never wavered.
I stood as a person and I decided to reject it and also teach or else even taught my people through barazas, through such kind of sensitization. Yeah, in fact, but most of them were laughing at me, saying that we were really wondering what is the chief telling us, because now his mother has gone and has gone through such kind of a thing. His wife, yeah, is living in a community which is practicing the same. So, in fact, they were really worried and even amazed on what I was telling them. Previously, it was when you talk about FGM, people could even live in your brother. Yeah, living just a few. Yeah, especially the elderly. They will leave you in the brother. Yeah, when you start mentioning something like FGM. Now the community changed the notion of which they were seeing me as an outcast or a person who was going against the odds and the traditions. Now they decided now to, most of them even coming to my home, to my office. Yeah, they are very eager even to know what, especially men. Yeah, because now some of them are also trained, and they are also, yeah, they have really changed. They have really changed. So I can see now as a person, I have achieved a lot, because now in my location, in fact, it is very rare to hear such kind of cases now. Very rare. In fact, like two years even from that 2021, I only heard about 2 cases.
Wenzetu wametutembelea wakati wa 2021. Sasa tuko na miaka 4 kuhusu FGM, hasa wakatufunza jinsi ya kuepuka naye. Walipotufunza tulikuwa na wasichana, mimi for example Helen kuna wasichana 7. Alafu mbeleni kabla tujafuata mafunzo tuliteketa 4, lakini wakati wa mafunzo tukapata hao wengine hujawahi teketa tena. Wakati tulipoondoka kwa mkutano ama wenzetu wametuletea, tukaanza kuongea ama kukutana kama balozi, kukutana kama chief, kuangalia ni nini ambayo itatufanya tuwe mfano bora wa FGM. Hasa nikajitolea kwamba mimi niko na wasichana 7, lakini kuanzia leo itakuwa mfano bora, sitawahi teketa tena. Na hata nilipofanya hivyo, hata wengine ambayo wale relative ambao wanatuzunguka, wao wakakata hiyo FGM tena, haikusikika tena, maana tulikuwa mfano bora ya FGM.
In 2024, we trained more champions across 5 counties. With newfound knowledge, they carried the message back to their communities. Today, we go back to Kajiado, where elders and Morans have since undergone more training, deepening their understanding and commitment. We meet one of the new champions.
Masomo kwa wazee imekuwa sawa kwa maana mara kwa mara tunawafundisha wenyewe kwa wenyewe juu ya FGM na juu ya ndoa ya ikiwa msichana ni kidogo, tulikuwa tunawafunza mambo kama hayo, lakini wameshikilia. Hakuna sehemu mzee, kuna mtoto mdogo, hakuna msichana ambaye amesalia, hakuna nani mjamzito akiwa mdogo. Sasa tunaona kwa hii community yetu sio mbaya, watu wanashikilia mafunzo vizuri. Kiingia kwa wazee, huwa ninajua kuongea juu, kuelimisha juu ya FGM kwa zaidi, kwa maana mimi mwenyewe nimepata mafunzo.
Our journey finally takes us to Wajir County, where FGM prevalence remains alarmingly high. Here, we engage young men through football, keeping our engagements young and vibrant. And in between the games, we hold powerful conversations on ending harmful practices.
And in Somali culture, men are the decision makers at house level, at any other program. When tabling, they are the ones who make decisions. An example, I'm educated woman, a professional, also who is activist for a long time, almost 10 years. But the solution I could not even make for that 10 years, even a small percentage change. But when I, engage men and I got this program of men movement, men and FGM program, I got actually, my heart is shining.
True to her words, her heart is at ease as she witnesses progress, men taking lead, changing old paths and protecting their daughters and girls across the community.
Out of that 10, let me say 7,000 imekaa. Kwa mfano kama wazazi 7,000 wamepata, na wanafunzi pia 3,000 wamepata, kwa sababu wazazi naeleza kule mashinani kwa msikiti, kwa kijiji. Shule watoto naeleza kwa shule. Kuna wasichana wale ambao labda mtu fulani amejitayarisha kukeketa hao. Tunapata simu. Tunachukua kama ni gari, kama ni bike, tunakuja. Tumesave wengi. So wasichana wale ambao tumesave, they are more than 10.
We engagements and we interacted. This is way forward now, and I have the hope for the next maybe 8 years, 9 years, we will have a big impact.
She holds hope that in the next 8 to 10 years a lasting impact will be seen. As we pause to reflect, we see how what began as an online campaign has grown into real change, transforming communities, touching hearts, and protecting women and girls, a true step to gender equality. Today, here and now, we are left to ask ourselves, what role will each of us play in shaping the future we dream of?
Let's appreciate MEND and FGM. And I think it's very clear that there are zero benefits of conducting this harmful practice. The old man is suffering. You've heard by yourself, right? Yes. So and it's a testament that with good education of the communities, enhancing their knowledge of how these are harmful practices, we are actually bound to change attitudes and transform those practices. There is a lady there who talked about she has 7 before education, 3 and it wasn't 3, right? 4. But after education, she stopped, and the other 3 now. So we need to make as many champions in the communities. And that summarizes the 12 solutions that were presented from yesterday. And I know definitely Esther will provide guidance on how we can create a resource pool for those solutions, so that we also facilitate collaborations that have been talked about in this workshop a whole lot. I think if there is one thing that has been mentioned over and over is collaboration and coordination. To a point at times I ask myself, what is coordination? What coordination is and what coordination is not. So those cases who presented solutions from yesterday to today, where are you? Yesterday to today, where are we? Quickly come to the stage, we appreciate you. Please come to the stage. The ones who did the 12 solutions presentations from yesterday. If you want to be sure, Akili Dada, there is what? Person-centered communication. This is, I think, from Igori, Clara, World Vision, Big Dreams, CSP, Morans, Isiolo women. Please be coming. We need to save on time. Marsabit, Mwado, Abdi. Yeah, and the SND, and then Too Young to Wed, and then now, the way we have hope. Yes. As we appreciate them, Winnie, start coming to the front. Keep your questions coming. I have a number of questions. Keep them coming. What we will do is that after lunch, we will create 30 minutes, especially for today's sessions, for guys to ask questions, make comments for like 30 minutes after lunch before we do the closing. So let's appreciate these guys even as they're being appreciated. Let's give them a good clap. Let's give them a 2025 clap. This is how we will clap. Got it? 3 go. 20. So 3 go. Thank you so much, guys, and thank you so much for really. Oh, there's a photo. Smile like champions. Thank you. Who is that finance guy? Oh, he's going to do the financial report. All right. All right. Right about now, we're going into the last session for this learning convening in terms of the panel discussions. And this is on donor coordination and learning sessions, which will be moderated by none other than Ms. Winnie Nyadigo. So Winnie, most welcome.
Thank you, it's Nyandiga. Good afternoon. Good afternoon. Mechoka na ni asubuhi. Good afternoon. So, as the moderator has said, we are going to move into our last session, I believe, which is on donor coordination, learnings, and future investment pathways. So I'm going to say what the session purpose is about, and then I'm going to invite my panelists to come on the stage. So what this session really actually wants to do is we want to see if donors are really putting money where their mouth is, okay? We are going to explore how coordinated donor investments, strong evidence, and strategic partnerships can advance long-term prevention, response, and I dare even say the eradication of harmful practices affecting children. The session will highlight funding lessons, alignment gaps, and opportunities for government. So, as I go to the context for opening, I'm going to invite Jackson Onyando from UNICEF, Yvette Kathurima from the Children Investment Fund Foundation, Honorata Githendu from the State Department of Children's Services, and Nolin Sang from Girls Not Brides to come to the stage and take their seats. As they're coming, I'm going to give the context. So over the past decade, what Kenya has seen is that development partners, you in the room, have played an essential role in Kenya's progress on harmful practices. You've supported communities' interventions, system strengthening, including even for government, research and policy reforms. However, many gains are still fragile. Fragmented funding cycles, duplication of efforts, and we've had that throughout the sessions here, and limited joint planning have often led to uneven implementation and missed opportunities. We keep on hearing how policies are good, but implementation is failing. Implementation is failing, yet Kenya has the best of the brains in the world. People come here to copy our policies, but why is the implementation failing? So this session is going to provide a platform for donors. Here we have donors and government and coalitions in the room, because it's going to be an interactive session to reflect on what drives effective investment, where coordination needs strengthening, and how Kenya can better align evidence, priorities, and financing, again, towards the elimination of these harmful practices. I am Winnie Nyandiga from Just Rights for Children. What we do is we aim to create an ecosystem to end violence against children, ensuring crimes against children do not go unpunished, and that survivors receive justice and rehabilitation with a sense of urgency. Throughout, I've had people saying, are cases being prosecuted? That is what Just Rights is doing. Today, from UNICEF, I had, are we really catering for the survivor when the cases are happening in court? Just Rights also wants to cater for survivors and ensure that they receive justice and rehabilitation with a sense of urgency. So I'll now move to the panel discussion, and I want to start with a warning. I'm hoping we can make it short and sweet, direct to the point, so that we get the information that is needed, okay? Thank you very much for cooperating. So, again, to introduce them, if you didn't hear their name, for people who do not have the program, we have Jackson Onyando from UNICEF. I know he's not a new face anymore. And then we have Nolin Sang, I believe, from Girls Not Brides Kenya. Then we have Yvette Kathurima from the Children's Investment Fund Foundation. And we have Honorata Githendu, Chief Economist. I'm so happy to see a woman Chief Economist. I know that they are, but most of it, so I'm so happy that you are on this panel. And I'm going to begin with the first question to Nolin. Nolin, from your work as Girls Not Brides, what donor approaches have worked well, and what needs to change to better support national efforts to end child marriage and other harmful practices? What donor approaches have worked well, and what needs to change?
Thank you, Winnie. I'll start with a disclaimer. Girls Not Brides is not a donor. But just a brief introduction to who we are. Girls Not Brides is a global partnership of over 1,400 civil society organizations across 100 countries, united by one vision. And that is a world where every girl has the right to choose if, when, and whom to marry and achieve her potential. So in Kenya, Girls Not Brides Kenya is part of this global movement, and they bring together various actors to just basically strengthen the ecosystem to bring change against child marriage and other harmful practices. So going to approaches that have worked, I'll highlight 5. The first one is what I've just mentioned, the ecosystem approach. As we know, child marriage is not a single issue. It is tied to health, it is tied to education, it is tied to justice, it is tied to livelihoods. So approaches that recognize this interconnectedness are very effective, and they strengthen the whole ecosystem rather than those isolated specific places. The other one would be long-term and flexible support. When local organizations are given multi-funding as well as trusted to do that and given that flexibility, you see them innovate, you see them come up with various solutions that adapt to changes, and this also strengthens their sustainability beyond the project cycles. The third one would be global to local partnerships, and a good example, of course, being Girls Not Brides Kenya. And by supporting such partnerships, you get to align the global commitments to local realities. You also get to strengthen ownership as well as build the global solidarity. The fourth one would be evidence and learning. When you support convenings as well as knowledge sharing, like here as we are doing right now, and cross-learning, you get to build the collective knowledge on how to address child marriage and what works and what doesn't work. And you also surface good practices that can be good practices that can be replicated somewhere else, as well as learnings based on what has been shared. The fifth one would be training and capacity building. So that builds skills, empowers communities as well as organizations, and that way you're just ensuring that beyond the donor cycles, there's sustainability to the work that is being done. In terms of what needs to change, I'll highlight 4 things. Basically moving from fragmented coordinated investment. Secondly, moving from short-term projects to systemic change. And thirdly, centering girls' voices both locally and globally, and also expanding the lens, because that one is rather short. I'll just go briefly into it. Just saying that there are other emerging harmful practices, and those also need to be addressed. Thank you.
Thank you very much, Nolene. I have seen what you said has worked, creating an ecosystem, long-term flexible support to what is not working, including not centering girls' voices. And I really like that, because throughout these sessions, we've heard about the importance of centering survivors in the work that we all do. So I'll now move to you, Yvette. From experience, what kinds of approaches, partnerships, and evidence have most influenced donor investment in ending harmful practices, and what lessons can help CSOs position themselves more strategically for future support?
Thank you, Winnie, and good afternoon to everyone. I want to start off also by giving a short introduction to CIF. The Children's Investment Fund Foundation is the world's largest philanthropic funder on children's rights. So we work to ensure that children not only survive, but they thrive. We have an endowment of approximately 7 billion, which is spread across different thematic areas: health, education, climate, and gender equality programs. In November 2024, our CEO reaffirmed CIF's commitment towards protecting children through a $125 million commitment to end violence against children. And this was reaffirmed this year at the Commission on the Status of Women, where CIF, with many partners, including those on this panel, hosted a high-level event on ending child marriage. So we are really looking to seeing how an end to child marriage could go to what Nolene spoke about, is addressing the root causes of violence within our communities. So I won't belabor the point around approaches, because Nolene has done a fantastic job on that. But I'll speak to how, as philanthropy, we approach funding towards these issues. So one of the things that we are currently doing is embarking on innovating financing agreements with different governments. So we appreciate that most of our governments are fiscally strained. They're going through a lot of challenges when it comes to repayment of debt, but we are in conversations with them around how we can come up with innovative financing instruments that will include KPIs that are linked to ending harmful practices. So if a government is looking at repayment of debt or conversations around repayment of debt, can we evoke a conversation around debt swaps, so that some of that money, instead of repaying a loan, would go towards supporting social sectors that impact on harmful practices like education, like health. So those are some of the conversations that we're having. We're also looking into conversations around green bonds with governments those that can go towards funding education and health. Again, looking at how we embed measurable social outcomes that are linked to the work that we are passionate about on ending child marriage and ending FGM. This, of course, will evoke many conversations and partnerships with ministries of finance, so I'm excited to have government on this panel because those are discussions that we can't just have as sector-line ministries or as philanthropy ourselves. But the role of philanthropy is to provide catalytic capital that would allow for these discussions to be held. Now, bringing that down to child marriage and FGM, Nolene spoke about the fact that we should go beyond looking at project-based activities to outcomes. So we are really keen and partnering with organizations that do that from a systemic lens approach and a sustainability approach as well. How do we work with you to ensure that coordination goes beyond working within silos to working through the ecosystem that has been mentioned? How do we ensure that if we are partnering with a global program, for example, we are not duplicating efforts that already exist, but really optimizing resources and accelerating systemic change down to the subnational level? Because one of the principles we hold dear is that we should focus on advancing localization and equity where the community is the voice of change. So I want to stop there and we'll be happy to take questions thereafter. Thanks, Winnie.
Thank you, Yvette. I'm not sure if you've answered the last part, that CSOs want to listen. How can they position themselves more strategically for future support? In just 2 minutes.
Sure. So we work through strategic grantees as CIF, which are partnerships that have been developed in different countries. So we work with groups, as I've seen Shofco represented here, who work with other partners on the ground. So we work with one partner as a prime or fiscal sponsor model, who then engages community-based organizations in that partnership. As if we don't directly fund community-based organizations, we work through broader umbrella partnerships. I mentioned the Global Program, for example. The Girls First Fund is another example of a donor collaborative which we funded. So we focus on that level of support, which then has downstream partnerships engaged with it.
Thank you very much, Yvette. Jackson, I'll come to you next. So from the UNICEF's perspective, what investment priorities should donors jointly focus on to sustain progress in preventing and responding to these harmful practices? And then the second bit is how can stronger donor coordination make national systems more aligned, efficient, and impactful?
Yeah, so I think another disclaimer, UNICEF sits right in the middle between donors and governments and implementing partners. Yeah, and I'm here really right in the middle of them. Yeah, for me, I think for Kenya, because we're speaking about Kenya, it's good to recognize where we are as a country. We are lower middle income country, so that means that there are certain expectations. And we're a member of the global community, so there are things that we can't qualify for as low as other countries would, because we've risen to a certain level. So there is a greater expectation for government to actually be on the driver's seat for most of these things. But we also know that there are deficiencies in government. So for me, so the first priority for me would be not to neglect where the action is. From day one, we've talked about social norms, and all the harmful practices we're talking about are greatly caused by norms in the communities, right? So funding organizations that are based in the communities is still a priority. And we also saw that social norms take a long time to change. So where we want to see quick fixes, I think my advocacy is that we'll invest in measurements, not only on prevalence, but small shifts in communities should be a priority. So we'll talk about norm shifting programs and all those that address behavior change. The other area is, if you were to draw any theory of change for any project, right at the bottom of it, most programs will talk about poverty as a root cause. So if you are going to fund programs and you're not addressing poverty, which is a root cause for many of these things, then we are doing lip service. So supporting social protection programs, and many of them come in form of, I think the most, Kenya is known for cash transfers, but we have other social protection mechanisms, and accompanying the social protection with the plus interventions. So just addressing the plus interventions without a cash component, because sometimes communities need to address the immediate need with cash. It's important that we focus on that. And then the third area as a priority for me is just harnessing monitoring data. Yeah, and the first presenter in the morning asked us, we have some data on FGM, we have some data on child marriage, but do you have data on intersect FGM? But virginity testing, bidding, we don't. But even for FGM and child marriage, we wait for 5 years for the surveys. Are we able to, and I talked about that in the morning, are we able to get some incident, the day-to-day data? And then the last area for me is many of the counties or communities where these practices happen are periodically affected by other shocks. Yeah? If you look at many of the ASAL counties, this is where we have the burden. So we make 2 steps and then the shocks come and wipe all the gains. Drought, floods, and all this. So funding needs to be flexible enough that organizations are able to move fast when a shock is coming, that they're able to tweak the development funding that they have to address the immediate and shocks. And now we even have technology that can help us to predict when the next shock will happen. So can we have some form of anticipatory action so that as we do development work, we can also anticipate that drought will happen in the next... I watched last night's news, the MPs from the north were already announcing some alarm for the counties there that we're seeing a crisis. Our program is able to be able to adjust quick enough with a lot of conditions to then address some of those.
Thank you very much, Jackson. And I agree with you. I mean, addressing poverty, right? Definitely at the root of so much that we are doing in terms of development and ensuring that the work that we do is sustainable. So I'll now come back to you, Honorata. And my question to you is, from a government planning and budgeting standpoint, the big elephant in the room. What forms of donor engagement best strengthen national systems, ensure sustainability of investments, and align external funding with Kenya's long-term child protection priorities?
Thank you, Winnie, and good afternoon, everyone. Thank you, my name is Honorata Givendo, working for the State Department, specifically in the Planning Department. Planning Department works very closely with the Finance Department, so we are just brother and sister, so I can be able to juggle around, that is between planning and finance. Now, I want to give the government picture now that my colleagues, my fellow panelists here, are bringing out the model, looking at the development partners' perspective. One, and the government picture, I want to give it right from the National Treasury. Funding in government, that is the government of Kenya, we rely on the exchequer, all the development partners. And I think Winnie and various participants, I would really wish that we move away from the wanted donors, because that is a want that National Treasury actually declined to a while back. We talk of development partners in government. And why does government really cooperate with the development partners? The government cooperates with the development partners because the fiscal space in government is very limited. And as we all see, even at the micro level in our households, funds have never been adequate. So what government is able to raise, that is in terms of revenue that is collected from you and me, in terms of our tax, it is never adequate to support the programs and projects within all the MDAs of government. So that is why we go to the development partners. And in terms of the implementation, that is in terms of the utilization of those funds, when government is allocating those funds into the programs and projects, we normally work with either development, we classify them into two, either development budget or the recurrent budget. And I can say that from where we sit in this sector, that is, sorry, in the student services subsector, being in the social sector, we are more recurrent than development in terms of our operations. And more specifically, even for the forum that we've been having for the last 3 days, these issues are handled as being recurrent in nature than development. Now, coming to the question now, I want to say that investments in government can never be done when you have not done good planning. We must do good planning, and then the plans are followed by investment. Now, how do we do good planning? The planning, and I want to not talk generally about the government, but specifically now in the subsector where we are in, and narrowing down to the children of this country. Our planning is the State Department for Children's Services, and with all the development partners that we work with. The starting point is, what is the mandate that has been given by the end for children's services in handling matters children. So the plan now comes in that when we are preparing government documents, we must make sure that we have exhaustively captured all the matters that we will be addressing going forward. Because I wanted to say that, and I also wanted to believe the partners who are here, that you don't just wake up and you are saying that I have 100 shillings in my pocket and I want to support so and so. You have reference documents that you make that you make reference to when you are executing anything, and those reference documents are actually now the part of are developed as a result of planning. Now in government, we have the main driver is the government blueprint, and for the past many years, the government blueprint in Kenya has been the Vision 2030, which started way back in the year 2008. And I can tell you participants here and fellow panelists that for the sectors who are very, very intentional in their planning, those are the sectors today when you move across all the counties, in the areas that you say you stay, you can see things happening. Why have we been able to see a lot of change in the Kenyan infrastructure? It is because Vision 2030, which was now the plan for the 30 years for the government of Kenya, some very conscious effort was put in some sectors. So over time, the Vision 2030, of course, we know that it is then broken down into what we call as government medium-term plans, which are normally 5-year plans. So we then break down step by step for these 5 years. What are we really supposed to prioritize in line with the mandate of the sector or the subsector? Then we move now to the budgeting. What kind of resources do we need? So I'll say that then after the medium-term plans, we move then to the government of the day, because lucky enough as Kenyans, the medium-term plans coincide very well with the start of the government. So when we are done with the elections for every year, after every five years, we are starting the next medium-term plan. Then the government of the day, what it does, it has what it calls a manifesto. The manifesto then really brings out what did the government, when they were doing their campaigns, what did they do did they promise to do to the Kenyan people? These promises must be funded for the Kenyans to feel that what they were promised was not just a campaign tool. It is something that is going to be delivered. It is going to require investment. So now coming to matters children. What I'll say in terms of the investment trends as a state department, and more specifically as a state department that is that the main, I would say the core mandate is matters on children protection. Our main focus it does not just start with us again at the state department level. We move with we move with the plan of the National Treasury, and specifically we have what is given as the resource allocation criteria for us to be able to work on the programs and projects that have been given that we are implementing as a state department. And I will say now that for us, especially on the subjects that we have on the harmful practices, so that we can be able to really see. To really look at the investments, what are we seeing in terms of our implementations. Our programs must really come out very, very clearly, and they must be aligned to the priorities that we have as a government. Then number two, in terms of the criteria that the National Treasury looks at, we have what's normally called the presidential or the cabinet directives. We can say tell you that when I was coming here, I asked someone, which meeting is this? And then I was told, in mkutano ya FGM. I was a bit challenged, and I think that challenge should also be moving to my colleagues in the State Department. We need to be very deliberate so that we pick little ones that can speak about children. It is true that we have FGM, which is actually one of the key discussions that we are having here. But in terms of the priorities that we have, and even as we make a very as we move towards very defined route for funding of our programs, we need ones that can really communicate. So when we talk of the presidential or the cabinet directives, we can look at what the other subsectors have been able to do. You come with a very good, catchy one that when it is mentioned everywhere, someone is able to see a child in it. It doesn't look like it is a cross-cutting one. So and that can once from the State Department with my colleagues, that's something that we should be able to work with, so that even as we look at the government funding, then we should again be coming back to the development partners to really move with us, so that we can be able to implement this project and really talk of research. Because if we talk of, for example, from 2011 to 2025, and we are still on the same thing, then we are not making progress in our implementation. Thank you.
Thank you very much, Honorata. So what I'm hearing is, or rather, what I would need clarification is, when government, and as the chief economist, when you're doing the planning and budgeting, do you do it with the development partners in mind? Like, this is what the government can do. We definitely know African governments and Kenya is struggling with fiscal capacity, and that has been said throughout these meetings. So when you're doing the planning and budgeting, where do development partners come in? Do you plan with them in mind, or you just plan with what you have, and then if we come on board, that's it?
Thank you again, Winnie, for the second question. When government is making its plan, its budgeting, I want to say this clearly, that all the government planning budgeting is coordinated from the National Treasury for all ministries. And I think most of us who are here, I can see quite a number of you. That is from the names that are in the list that participated in the Public Participation Forum at KICC. That is actually the first step towards the budget for the next financial year, the year 26-27. Now, when we budgeting, your question is, do we budget with the development partners in mind? I will say yes. We budget with them in mind because of the reason that I said, that I gave when I was starting, that we know the resources are not available. And I can tell you that I was in Mombasa when we were now getting the initial, what they call the resource envelope. The demands that we went with, now that we are a new state department, we did not even get, I think if there was an addition, it was a 0 point. Yeah. So government must always plan with the development partners in mind because of the limited resources that we have as a government. Thank you.
Okay, thank you very much, Ms. Honorata. I will now come to the audience, and we will take 3 questions. Please make it short and sweet, and the panel, please answer the question as it has been asked. Can we get help, MC? Do you have questions? Any questions? Going once, going second? We have one here.
Thanks so much for this opportunity. Maybe for those who, member of the panelists that were not here the first 2 days, my name is Dr. Helen Gado, Director, One More Day for Children, Foundation Kenya, based in Laikipia, part of Saburu, Isiolo and Meru. We run a shelter, a safe house for girls rescued from FGM, child marriages, and Saburu bidding. Now, my concern about the donor or the funders is on the short-term funding. We are at the grassroots. We see visitors. You understand what I mean, visitors? New agencies, new organizations emerging because they sat on a desk, wrote a proposal, went through. They said they are on the grassroots. They are in Marsabit, blah blah blah, all that. Yet they don't even have a physical office. They are not even known. But when they are funded by the funders, is when they come to introduce themselves there. While we have others who have been there for long, they understand everything, the culture, the dynamics, and all that. So therefore, they come creating hopes with a lot of energy in advocacy, and then after that they leave. There's no sustainability of whatever activities they have come up with. And sometimes they confuse even the children themselves. It also leaves something to be desired when you come to the same funders, funding activities to do with advocacy and leaving the interventions. So why are you funding advocacy? It's like telling people or coming to my area there, maybe the pastorates, saying that cattle dip is good, use the cattle dip instead of spraying with herbs. But you don't provide that the cattle dip. Yeah? So you raise awareness, you give funds for creation of awareness in hotels and whatever. Then the survivors, when they run away, they don't know where to go. The same agencies are saying we do not have funds for rescue, we do not have funds to take you to school. I feel that fathers really need to revisit some of these policies. Thank you.
Any other question in the room? We have one question there. Please, 2 minutes.
Yes, thank you for that opportunity. My name is Penina, GBV coordinator Laikipia account, and I'm also a mental health practitioner. My question goes to officer from the State Department for Children's Services. Do the State Department for Children have a plan or a strategy plan for mental health services? Because all what we are speaking from day one, it's about reproductive health services and mental health services for the children.
Did you get the question? Sorry, just repeat the tail end of your question. Do they have a strategic plan on what?
Yeah, now that she's part of the, she's a member in that planning for the State Department for the Children, is there any plan or any strategic plan for mental health services for these children that you are speaking from day one? Because what we are speaking from day one, it's about reproductive health services for the children and also mental health services for the children. Is there any plan for that?
Thank you, that's clear. One more last question. Okay, so we'll just take those two and then we will wrap the session.
First one. I'll attempt to answer the first one, but I'm sure colleagues also spoke to it. So more than one of us talked about a new approach called localization, that current funding, especially for these harmful practices that come to communities, actually come to community organizations that are already existing and implementing those interventions in those communities. Of course, there are issues around accountability and things like that, and also how you get to know that those opportunities exist, which is a different conversation that we can have. But whether there is someone in between, the actual implementer of most of interventions right now are localized organizations, and a number of development partners have adopted localization as an approach. So advertisements will be made or call for proposals, but in terms of the selection, we'll be looking, one of the things that you have to demonstrate is your presence in the geography that you claim or you want to implement your activities on. Localization is also not just also for government, right? We have a devolved system. We know that some interventions are not devolved, but national government is present up to the village elders, chiefs, and all. So localization also means working with those national government admin officers on the ground. So anything that CSOs do, there has to be some collaboration with chiefs and the law enforcement agencies.
I can also add very briefly around due diligence. So one of the things that has to be embarked on before any grant is given is due diligence. In addition to localization, as Jackson has said, there has to be credibility on the basis that you have knowledge and networks within the community that you're working on. But at the same time, it goes back to, again, a shift from activity-based to results-based funding. So we are no longer funding activities for activity's sake, but funding and even paying on the basis of performance, which is linked to impact. So really looking at how we are getting to the needs and supporting the needs of the survivors, for example, is what will be funded vis-a-vis the talked about. But I want Nolene to speak to advocacy because I know this is very keen. Before I hand over to her, I'll also just flag there's definitely a tension between funding advocacy versus funding service delivery. But the idea for funding advocacy is that you have to have an enabling environment for services to be provided. So it's not one or the other, but the two go hand in hand.
Thank you, Yvette. I was actually going to touch on something slightly different. But ties to what has already been mentioned in terms of accountability, in terms of being intentional, in terms of the due diligence. While people show up in your community or come to visit your shelters and all of that, it's also our own responsibilities as individual organizations in terms of finding out who this is, because at the end of the day, you're the one who's on the ground, you're the one who's implementing, and it is your choice at the end of the day in terms of the values you hold, in terms of the work that you do, as to whether to engage with this foreign entity coming in saying that this is what we want to support. And it's also your individual responsibility now tying to advocacy in terms of being able to show them that this short-term investment isn't going to work, and this is not going to be possible to do or see that change within this period that you want to do this, and also be able to guide them in terms of this can be better invested in a different way. I hope that captures it.
Thank you very much. As you can hear, they are saying that they are putting their money where their action is. And I know it is a process, but I know we are going to make it right. So to you, Honorata, and the strategy plan, is there any plans for mental health? We've kept on talking about reproductive health only.
Okay. Thank you. Thank you for the question. I will say that we don't have a strategic plan for mental health, but I think allow me to emphasize that strategic plan is a very broad term when that is in government, not like, for example, with the development partners world. The strategic plan that we have developed after becoming a state department is going to run to the year 2027. When we come to the end of this government, then 2028, we'll be having another strategic plan. So inside the strategic plan that we are just finalizing for the State Department, we have what we call the key resort areas, which are normally aligned to the mandate that was given, that was spelled out in the Executive Order number 1 of June 2025. So from the key resort areas, then as a State Department, we are then supposed to go ahead and then start developing policy, the necessary policies. That is where there are gaps. Then we should be working on regulations. We should be working on guidelines. We should be working on standards. So matters to do with mental health from the State Department's perspective may not be a strategic plan, but it should be now in forms of guidelines or standards or documents of that matter. And I know for now from the State Department, we already have quite a number of guidelines that and other documents that we are developing, and possibly I'll be finding out. But what I know, we don't have a document yet. But this one, I know once it gets to the point of being developed, that is, if it is not there, as a State Department, we should be closely working with the Ministry of Health because it is touching on matters health. Thank you.
1 minute.
I think what Madam has mentioned at the tail end is actually what I wanted to say, that we are looking at the whole of government, so that it doesn't have to sit with the State Department of Children's Services, but it can exist in another government like Ministry of Health where you work. So this State Department has a mandate as given either through the Executive Order or through the Children Act, and the Children Act assigns other roles as well to other government agencies. So their real work sometimes will probably be just to coordinate, but to ensure that other government agencies are able to provide that service. Mental health is an expertise. It's a specialized service. So you'll probably find that children officers can offer psychosocial support, but when it comes to mental health, then they need to refer to another government agency that is able to provide that, and that's why in the morning we also talked about that coordination, so that if it can't be provided by the State Department, they're able to refer that to the Ministry of Health or the County Department of Health.
Thank you. Just with the mic, I want us to do a quick wrap-up reflection. I'm going to give everybody 1 minute. So the question is, what is the one shift in donor engagement that would strengthen Kenya's progress the most in the next 3 years? What is the one shift in donor engagement that would strengthen Kenya's progress the most in the next 3 years? I'll start with you. You have the mic.
I think for me, one shift is recognizing government that they have the utmost responsibility. Everyone else is either doing advocacy or a supportive role, but the onus is on government. So whatever it is that we do, We must recognize government systems. We must recognize their plans, frameworks, and any support that goes to CSO, civil society, there must be an equivalent support that goes to the systems. As someone has said, advocacy must be accompanied by those services being available. And who is the primary provider of those services is the government. So we need to invest in government processes, government systems, and I really like some of the questions that were asked. When the government is doing planning, at different state divisions within that state department talking to each other. When the economists and planners are talking, are they talking to programmers so that we are thinking long term, right? And so that we're not having things for 1 year, because is it 4 or 5 years, the medium term, so that whatever we can't do this year, we can continue with it the following year, and so on and so forth. Thanks.
Thank you, I love it. It begins with the government. Every other role is supportive role. People should do their work.
I'll build on that, Jackson. It does begin with the government, and the government of Kenya has made very firm commitments in international spaces at, generation equality at the Bogota. So generation equality, the government of Kenya committed to building safe houses in every county. In Bogota, we committed to, protecting the children and being the key ally in terms of avoiding child marriage, avoiding FGM. Our former government committed to ending FGM by 2022. So government of Kenya has made very firm and strong commitments, if implemented, would really change the scenario of children in this country. So if it starts with government, how do you then coordinate the action with development partners, with civil society, with community-based organizations, really utilizing all the resources that are available to you to support you, because we are all committed to seeing children not only survive but thrive in this country.
Thank you very much.
Thank you. I think for me it would be the framing. So child marriage is not, I'd say it's not charity work. So framing it as a violation of rights for girls, a violation of girls' rights, and speaking to that and linking it to the development of Kenya would be important to make sure that that framing is right. But in terms of the one thing, it would be partnerships. The strong partnerships, be it through with government, with religious leaders, with CSOs, putting all those people to work together and be intentional in terms of how they're spending the money, where the efforts are going, and what is being responded to. That is key.
Thank you, Nolene. Yes, to you as well.
Thank you. What I would want to say, and I want actually to just emphasize the linkage between the development partners and the government of Kenya. When you are working on your frameworks, and at one point, especially for example, on your financing increments and any other document that you are working on, you would need the input of the county government, maybe the COG or the National Treasury. Please involve them in as early as possible. Don't come with a document that is already finalized, and you're just asking for a signature, because we have seen some very good development partners not being able to work, not being able to execute what they wanted to execute, not being able to have their funds released, because you missed a step, and not National Treasury tells you, no, this is not possible. Work with us so that we help the child of Kenya.
Thank you very much, and I also agree. My reflection also, just what has been said, it has to begin with the government, even in terms of accountability, but also sustainability. But also just to echo what Nolene has said, that let us look at child marriage no longer as a moral issue, but as a criminal issue, because if FGM has been criminalized, so What about child marriage? Ladies and gentlemen, that has been our session. We've had Jackson Onyando, UNICEF, Yvette Kathurima, the Children's Investment Fund Foundation, Nolin Sang, Girls Not Brides, and Honorata Githendu from the State Department of Children's Services, and I am Winnie Nyandiga from Just Rights, your moderator for the day. Thank you.
Thank you so much. We will appreciate you with...
Petition Jackson has had so many of this. I hope he returns some of them.
Thank you.
Thank you very much.
Thank you. Thank you. Pamoja. Pendan, let me at a middle wear this. All right, let's appreciate them one more time as they go down. Thank you so much. Thank you. Thanks, Winnie. All right. Now, quick announcements. The first thing is that we need to go for lunch for about 50 minutes. Like I said, we need to finish here by 3. You go home before those who are attending the different graduations that are happening in the different colleges before they finish. Otherwise, if we leave here, once they're finished, we will join them along Thika Road as we do the parking. The second thing is that from the registration desk, they're informing us that the numbers that have been documented there are way less than the numbers that are seated here. So if you have not registered, please take some few minutes, go to the registration desk, ensure that you register. That is part of data for this convening. The third thing, how many of us are on Twitter, X? How many are actively, okay, not even actively, how many of us are on X? Very good. When we come back in the afternoon, there's something that we need to do, because there's a hashtag that someone sat down and thought through. That was not meant for projection. It was meant for us to use it. So we'll come back and use it in the afternoon. So at this point in time, ladies and gentlemen, I'd want us to go for lunch, 1:10. So exactly 2, we start. Abdi, do you want to say a short prayer for lunch? A very short one. Tony? Tony?
Okay, I'll say it in Arabic. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين.
So if you have not registered, please pass by the registration desk. That colleague with mail cards, where are you? There is a colleague who had mail cards. Where are you? Oh, she's outside. Oh. If you don't have a mail card, pass by the registration desk.
other duties to perform. Nilikuwa wapi hiyo nini yangu? Niliweka sinto.
Sijui. Uliza Jackson. Same taste. I've just arrived, but I have some now. Ukiwa umeketi hapo mbele.